Are you trying to lose weight and you have a thyroid problem as well? And you think that losing weight with the thyroid is impossible. If you have these belief in yourself, then break your belief, because I am going to discuss with you the tips which will help you to lose weight. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, a hormone specialist doctor from Mumbai, India. Now before I begin this video, one important information. If you want to watch this video in Hindi language, then on the I button and in the description box there is a link. If you click on that link, then this video will be played in Hindi language for you. अगर आप इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन पे और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है और उस लिंक पे अगर आप क्लिक करेंगे तो इस वीडियो को आप हिंदी भाषा में पाएंगे. सी वेट लॉस, इट्स अ वेरी कॉमन प्रॉब्लम ऑफ ईच एंड एवरी पर्सन एंड लूजिंग वेट कैन बी अ वेरी फ्रस्ट्रेटिंग. In fact, when we want to lose weight, we need a discipline and we need a dedication. But the moment we lose that discipline and dedication, even for a few days of time, and you end up indulging your favorite food or you don't go to exercise, your weight immediately shoots up in the scale. And if you have a thyroid problem, the shooting up can be more than any other person. So does that mean that if you have a thyroid problem, you will not be able to lose weight? Answer is no. You can lose weight even if you have a thyroid problem. And how do we achieve that? That's what this video is all about. I've got a plenty many requests from the viewers like you and to the patients who come and visit me in my clinic. They all tell me, ma'am, please make one video on this topic because this is something which is our day-to-day life struggle. Well, I'm trying my level best to help you achieve your health goals. Now, so this entire topic I have split it into two sections. Section 1, wherein before you start attempting to lose weight, what you need to do with your doctor, what you need to discuss with your doctor. And second section is once everything is fine, what you actually have to do in your practical day-to-day life. Alright, so we'll talk about the section 1 first, what you need to discuss with your doctor. Very first thing is get your diagnosis correct. Yes, very important. See, understand that nearly 60% of the people who have a thyroid problem don't get any symptoms. And that's the reason why many of the times the thyroid imbalance gets unnoticed and undiagnosed. In fact, weight gain and unable to lose weight is one of the very common symptom of a hypothyroidism and one of the very common reason why people also do a blood test. So if you are struggling with a weight gain, then speak to your doctor, get your thyroid level checked. Many a time what happens that people delay in the diagnosis. And this delay in the diagnosis causes lot of weight gain which can be again difficult to get rid of. Many a times, many people have a mild or a subclinical hypothyroidism wherein the TSH is not that much elevated. Again, this contributes to the lot of weight gain. So first thing first, get your diagnosis corrected. And once you know that you have a thyroid imbalance, start your medication as advised. Now the moment we talk about the medication, how do you take this medicine? That's also very important. It is not your regular pill that you can pop up anyhow. Thyroid medication has to be consumed in a very scientific manner. And how do you have to take that medicine? I have made a separate video for that. So do watch that video so that you don't make up any mistakes which can contribute to the imbalance of the thyroid hormone. Because plenty many times we have seen people making lot of mistakes and that's the reason why you don't get full benefit of your medication. So that's the second thing. Now, third important thing is that discuss with your doctor that your thyroid, is it in the optimum range or not? Now see, when it comes to the treatment of the hypothyroidism, TSH is one of the very commonly used tests. And the normal range of the TSH is a very wide. And many of the time what happens that after the medication, if your TSH remains in the normal range, however, if it is not in the optimum range, you might not be able to lose weight. Optimum range of each and every individual is different. So you speak to your doctor whether is your thyroid in the optimum range or not. And if not, try to bring that in optimum range so that your weight loss journey becomes easy. Having said that, along with the thyroid hormone, again ask your doctor to run few other testing. Other testing, especially like that of the nutritional deficiencies, which again leads to lot of issues. Many of the time this nutritional deficiency makes your thyroid sluggish. Nutritional deficiency causes lot of fatigue, and that also prevents you from doing any kind of a physical activity and may cause you weight gain. So nutrients like vitamin B, vitamin D, iron level, hemoglobin level has to be checked. Also ask your doctor to check your liver functions. Yes, very important. See, liver is a very essential organ when it comes to our body's metabolism. Now when we talk about the body's metabolism, the thyroid hormone, the T3 and the T4, their metabolism happens in liver. The medication which you are going to consume for thyroid imbalance, that also metabolizes in liver. So if your liver is not functioning properly, there is a very high chances that you will not be able to lose weight. So please speak to your doctor that do you have any fatty liver, and if yes, you need to address that issue also. Also work with your doctor to check on your other hormonal imbalances. Now other hormonal imbalances like prolactin, again very commonly associated with the thyroid imbalance. So if you have prolactin imbalance, correct it. Similarly, there is an insulin hormone and a leptin hormone. Many of the times when a patient who has a hypothyroid, they have invariably insulin resistance. Insulin is one of the very important hormones to maintain our blood sugar. And this insulin hormone comes from a gland called as a pancreas, which is located in our abdomen. So if you have an imbalance of the insulin, again you will have a tendency to gaining weight. Also, people who have a thyroid problem also have a higher chances of PCOS. So work with your doctor to find out whether you have insulin resistance or not. Similarly, leptin is another very important hormone. If you have an imbalance of the leptin hormone, again you will gain weight. So if you have these imbalances, you have to correct it. Similarly, if you are leading a very stressful life, you will have a lot of high level of the cortisol hormone, and that will also contribute to the weight gain. So if you have any cortisol related issues, again very common condition called as a Cushing syndrome, again you will gain weight. Similarly, if your body does not have a sufficient level of the hormones like a growth hormone or a testosterone in men, this will again increases the weight gain and reduces the weight loss. So work with your doctor, talk to your doctor that do you have all of these problems or not, and if yes, get it corrected. Also, talk with your doctor about the other medications which you are taking. See, thyroid patients invariably take many other medications, and many of the times these medicines can also contribute to the weight gain and they don't know about it. So talk to your doctor and work upon your prescription. If there is any change, if there is any alternatives available, switch over to that. Commonly taken medicines like propylthiouracil, carbimazole, methimazole, what we use it for hyperthyroidism and Graves' disease, that causes the weight gain. Beta blockers, again this is commonly used for patients who have hyperthyroidism, high blood pressure, any heart condition, again causes the weight gain. Medications like steroid, again commonly used by thyroid patients to manage their joint pains, especially if you have a rheumatoid arthritis, again this causes the weight gain. People who have a PCOS along with the thyroid, they take some hormone contraceptive pills which contains estrogen, progesterone, that also contributes to the weight gain. Similarly, medications which is used to stabilize your mood, the medicines to use correct your depression, like carbamazepine, valproate, lithium, then sertraline, fluoxetine, all these medications also causes the weight gain. So sit with your doctor, work up on your other prescription drugs, whether are they contributing to weight gain and coming on your way to lose weight. So these are the things which you need to keep in mind when you are trying to lose weight. So please speak to your doctor. And once you have spoken to your doctor, your diagnosis is correct, you are taking medicine in a right way, your thyroid is optimum correct. Now what? That's what the part 2 is all about. So once everything is done, that's where you need to work up on your mindset. See, whatever tips I'm going to discuss in the part 2, okay, is all going to be for a lifelong. Understand, these tips are just not for a overnight, okay. Gradually this has to be a part of your life, because the weight issue with the thyroid person is not a 1 or 2 day story, it's a lifelong story. So of course the changes also you'll have to do for your rest of your life. Try to do changes slowly if it is difficult for you in the beginning, but yes, you have to do it. Positive mindset is very, very important, and at the same time you have to set a realistic goals. See, understand your weight gain was a slow process, so same thing will go with your weight loss. People want to lose weight fast. Quick results will not last for long. So keep a realistic goal and take one goal at a time. And also do not try to compare yourself with your other family or your friends, because everybody's body is different, everybody's metabolism is different. So having said that, what are those tips? In that, the very first important part is played by the food. See, food is a foundation of our survival, and if you pay attention to the right kind of food, then it is easy for you. Try to incorporate more anti-inflammatory and reduce consumption of the inflammatory foods. Okay, please pay attention to the cooking. Nowadays people end up with a restaurant style food eating habits, ready to eat food and a very easily available processed meal. Try to reduce that and spend some time in cooking your own food. That will give you a benefit over a long term. As long as possible, try to use a clean and organic food products which are devoid of any kind of processed chemicals. Alright, now let's talk about the food. The very first thing is that the calorie restriction. Now calorie restriction is important when we talk about the weight loss. On an average, when you restrict yourself of around 500 calories a day, you will be easily able to lose up to 2 kgs a month. And losing 2 to 4 kg maximum a month is advisable. If you try to lose more than that, your body will go into a resistance zone. So yes, restriction of the calorie is important, but not too much of a restriction. Because what will happen if you restrict yourself too much, then once your body goes in a defense mode, the thyroid hormone production goes down and that will cause you more weight gain. So don't do that. So how you can reduce this 500 calorie? Very easily it can be done by removing all those food items which you usually don't need for your survival. So food items like bakery, food items like cookies, biscuits, soda, cake, pastries, we don't need it for our survival, isn't it? And that's what you need to avoid it. So that's your calorie restriction, very important. Now once you have restricted your calorie, and the most important food which you have to eliminate from your life, that is a sugar. Yes, sugar is one of the biggest enemy of today's time. There are people who are sugar addicted now. There is a smoking, there is an alcohol addiction. Similarly, nowadays there is a sugar addiction. And this sugar contributes to a lot of cellular inflammation and which gradually causes a lot of health problems. So cut down on all the white processed sugar from your diet. This is the most important tip among all. Okay. Now you have to, what you have to eat. So again, you can incorporate more of an anti-inflammatory foods. Okay, so anti-inflammatory foods, what you get it in an onion and a garlic and a turmeric. Anti-inflammatory herbs like you can get it in thyme, rosemary, try to include that. Try to include non-dairy fermented food like apple cider vinegar, kombucha, include that. Include more of a protein in your diet, like you get it from the poultry like a chicken, eggs, then you can get it from a pork. Try to include more of a selenium and iron rich food. Include more of a seafood because they have a lot of iodine content. So once you have all these food, it is better for your thyroid function. At the same time, you have to restrict yourself from couple of food items. First one is the gluten free. So anything which has the gluten, try to avoid that. Gluten is nothing but a protein which is profoundly found in a wheat related food products, and people who have a thyroid problem have difficulty in digesting this gluten, and that causes the cellular inflammation of the intestine. So try to avoid that. Second, go soya free. Soya again interferes with your thyroid hormone production. So reduce or eliminate soya completely. And third is a dairy free. Now many people are allergic to lactose and that causes a lot of health issues. So try to go for dairy free. So we saw dairy free, gluten free and a soya free. Having said that, get yourself tested for a food allergens. Many people are allergic to food substances and they do not know about it. And once you keep consuming this food, there's a lot of cellular inflammation which happens. Many people are also allergic to nuts. So if you are allergic to such nuts, then you might even have to avoid them. So these are the food products which you need to avoid. One other very important part of your diet is the water. See, water is very important to boost up your metabolism. It reduces the bloating, it reduces the constipation. It makes easier for you to have a proper bowel movements. And better the bowel movements, better will be the functioning of a digestive system and will help you maintain your weight. Also, good amount of water will reduces the bloating and swelling which is found in your body. So you can incorporate at least 2 to 3 liters of water every day. Again, include more of a fiber in your diet. Fiber is nothing but it adds a bulk to the food. So it reduces your appetite, it makes your digestion better and it makes you control your food portion sizes. Fiber, you can get it from all the fruits, you can get it from the whole grain products, you can get it from the green leafy vegetables. Nowadays, we also get a fiber supplement. You can incorporate that also. Many chia seeds, isabgol, husk, psyllium husk, what we call it as, and basil seeds, again they have a good amount of a fiber. So try to include that. Another very important part of a diet is a time restricted eating, what we call it as a intermittent fasting. See, what is intermittent fasting? Here you are going to restrict your food intake for particular time period. In the beginning stage, people try with a 12 hour of a intermittent fasting. Gradually you can progress to 14 to 16 hour intermittent fasting. By the way, how intermittent fasting has to be done, I will make another video for you to understand that better. So during this intermittent fasting period, you are not going to eat something, and that is the time you are giving your body to heal. And especially when you do intermittent fasting, your weight loss journey becomes very, very easy. So you can do intermittent fasting. However, try to end your fast at least 2 hours prior to sleep so that there is no blood sugar fluctuations. Now, if you are not able to do intermittent fasting, in that kind of a situation, distribute your food into small portions. What happens when you have a thyroid problem, your digestion also slows down and that causes the weight gain. So if you eat a small frequent meals, your tendency to gain weight reduces. However, make a note that if you have a diabetes and you are on medication for that or you are taking insulin, please speak to your doctor before you start any kind of intermittent fasting, because we have seen many patients going into hypoglycemia and a low blood sugar which can be life threatening. So work upon that. Another very important aspect of the weight management is the stress. Yes, in today's time, we all are leading a stressful life, and the more the stress hormones, and more the stress hormones, more the weight gain. So you need to reduce your stress. Okay, so you can try many tips for the stress management. I have made another video for that. So if you are living a stressful life, do watch that video so that you will get a good information. Another very important tip is sleep. We all need around 7 to 8 hours of sleep. However, we do not achieve that goal. Secondly, if at all we try to achieve that, we have a lot of fragmentations in our sleep. And many times people who have a thyroid problem also have sleep issues. And many of the times, due to the urbanization, people are sleeping late night. And all this causes lot of hormonal fluctuation. Especially late night awake disturbs our circadian rhythm of the hormones, and that causes the weight gain. So work on your sleep. It is a very important part of your weight loss treatment. Okay. By the way, I have made another video for that. If you want, you can watch that. Another thing is that cutting down on your addiction, whether that addiction is for your alcohol or a smoking or even a tea or a coffee. Once in a while, you can have a coffee, and if you want, you can incorporate a green tea in your diet. Again, a chocolate addiction is very common. Reduce that, but yes, dark chocolate can be eaten in moderation so that it will boost up your metabolism. Another thing is exercise. If we talk about the weight loss and if we don't talk about exercise, your goal will not be achieved. So exercise again is very important. 60 minutes a day, at least 5 to 6 days a week is important. If you're finding difficult in the beginning, you can reduce your exercise in 2 to 3 portions. Again, start slowly, because if your body is not used to exercise, suddenly if you do exercise, your joints and your muscles can be under tension. So you can start gradually and slowly and then increase your exercise capacity. If you have any kind of a heart problem, you must check with your cardiologist doctor, do your stress test and a treadmill test to check out whether you are a right candidate to do a exercise or not. Again, when we talk about the exercise, the better the kind of exercises you do, which will make you feel happy, that will make sure that you adhere to your exercise program more frequently. Also, when we talk about the exercise, over exercise is also not good. Many times people become over enthusiastic and lands up 2 to 3 hours in a gym. Don't do that. Your body will go in a defense, and in fact this will make you gain weight. So 60 minutes a day, at least 5 to 6 days a week is considered healthy. Now we talk about some vitamin nutrient supplements which you can take. In that we have iodine and selenium. Both are very important for your thyroid healthy function. Then vitamin B and a vitamin D, again that contributes to a lot of fatigue and inflammation. So when you take that, you will feel better in your energy to do any kind of a physical activity. Then anti-inflammatory medications like a curcumin, which is again very important because thyroid imbalance is many times inflammatory in origin also. So curcumin and ashwagandha will help you. Glutathione, a very important antioxidant which helps you in fighting the oxidative stress created by the inflammation. By the way, all these supplements are below in the description box. I have left a link. If you want, you can buy from those links. However, my general advice to everyone will be always consult your doctor before you start on any of the medication, even though it is a supplement. Right? So these are the important points for the weight loss. But most importantly is your mindset. See, mindset is very important. As I told you in the beginning that the weight loss can be frustrating at times. You may not be able to achieve your results as you desire. However, even if you are going in a positive direction, it is more than enough. Do not try to compare yourself with your other family member or a friend, because your body is unique. At the end of the day, I always tell my patient, Most important is you feeling best of yourself and having a healthy BMI. We are not here to trying to achieve a size 0, okay, but as long as your body is healthy, you are able to function better, your overall quality of life is better, and you are losing a little bit of the weight, though it is a slow progression, as long as there is a progression, it's good. Alright, I hope after watching this video you got some good useful information, and if you like the video, please click on the like button. If you are new to my channel, please don't forget to subscribe. You will get more and more health related information, especially diabetes, thyroid and hormones related information. And if you have any of your personal question whose answer you are seeking for, write below in the comment box. I try to read and answer them as early as I can. We will meet again with some new good useful information. Till then, take care of yourself. Namaste.